So discussing about the branches of the axillary artery is where this diagram comes in handy. Look very carefully. I mean, obviously there are a lot of branches, but you need not worry. They are pretty simple to understand. First of all, let us label down a few of the very obvious things. I mean, this is the sternum, obviously. No problem in that. Right? And these are the ribs. Among the ribs, we are very interested in this rib, which is the first rib. So this is the first rib. We are very interested in this one because obviously, for obvious reasons. This bone over here, which is cut, can you see? This is the proximal part, this is the distal part of the bone. The intervening part has been cut so that we can get a better look at the axillary artery. This is the clavicle. The clavicle. So this is the acromial process over here. So let's quickly diagram that, or rather label that as well. This is the acromion. Okay, it has gone out of frame. Okay, now. So now let's get on with the real deal. As you can see, this is the obviously the subclavian artery. Why this is the subclavian artery? Because outer border of first rib we have not yet reached. This muscle that is, by the way, arising from this first rib superior border, which is also sometimes demarcated as just like we said that the outer border of first rib is the demarcating point for beginning or initiation of the axillary artery. Sometimes we also say that this muscle marks the initiation of axillary artery. This is the serratus anterior muscle. Okay, serratus anterior. Anyways, just to give you, an anatomical overview. First part of the axillary artery. Now, before we get on, there is a very interesting thing which nature has played here, and that has made our medical students' job much easier. You know what that thing is? Very interestingly enough, these parts of the axillary artery, they give the number of branches that they each give is corresponding to the number of the part itself. What I mean by that is the first part has only one branch, second part has two branches, and third part has three branches. Like, how much more convenience do you need than that, right? So that is very convenient for us. First part gives only one branch. As you can see, I have labeled, or rather I have drawn it over here. This artery, this is the superior thoracic artery. It is actually a small branch. It is not pretty, it's not big or anything. It's a small branch. So let's label this. This is the superior thoracic artery. So as you can see, I mean, you are more than equipped to just know the name of the branches. But just for the sake of a little bit more knowledge, we can give a little bit of description about all these arteries. But for the most part, if you're not okay with it, just know the name of the branches. Okay? Anyways, a little description about the superior thoracic artery. As I just now mentioned, thoracic. So obviously it has something to do with the thorax. And as I just mentioned, first part branch, very small branch. First part of the axillary artery, right? And as the diagram is suggesting, it is running downwards and a little medially as well. It is running downwards and a little medially as well. What does it supply? As its name suggests, it supplies the thoracic region. To be a little bit more precise, it is actually supplying the thoracic wall. Now tell me something. What are the two most important muscles of the pectoral region or the thoracic region? I already named it, pectoral. So yes, pectoralis major and pectoralis minor. And guess what? Superior thoracic artery, it ends by supplying both the pectoralis major and pectoralis minor. So as its name suggests, thoracic, it ends by supplying the thoracic wall muscles, which is the pectoralis major and minor. That is the only branch of the first part. So pretty simple. Done. Second part. Okay, now second part has two branches. One of those branches is this thick. I've made it thick intentionally because this thick branch itself has again 4 sub branches. But don't worry or don't get paranoid about this. The branches are very simple. Okay, first let us name the actual branch. See, this thick branch, which is actually arising from the second part, this is actually labeled as the thoraco-acromial artery or the acromiothoracic artery. If you name it acromiothoracic, there is a slight advantage that you have. See, superior thoracic, acromiothoracic, and later on another branch from the second artery, second part will be the lateral thoracic. So all of them will have suffix as thoracic. If you remember this as acromiothoracic, then this will be an advantage for you. How? Superior thoracic, first part, acromiothoracic, and lateral thoracic, second part. We haven't yet talked about the lateral thoracic. First, let's talk about the acromiothoracic or thoraco-acromial artery. See, this thick thoraco-acromial artery, it is emerging at a very important point from the second part. It actually emerges from the upper end, or rather upper margin of the pectoralis minor muscle. Another very important thing about this thoraco-acromial artery is that this is one of the structures which pierces the clavipectoral fascia. Very, very important. When we move on to the model section, like later on we'll talk about, when we talk about the relations and all of that, we will talk about the clavipectoral fascia, although we won't talk about it in details. It's a separate topic altogether. There we will see that there are a number of structures which pierce the clavipectoral fascia. Very important to know. One of those structures is the thoraco-acromial or acromiothoracic artery. Acromiothoracic artery has 4 terminal branches. 4 terminal branches. What are they? One branch, as you can see, it is coming down like this. This is the pectoral branch. The pectoral branch. This is also known as the breast branch. In case of females, these are large and they are known as the breast branches. So obviously pectoral, so again they will supply the pectoral regions or the pectoralis major and minor muscles, and the breast in case of females, right? That's the pectoral branch. Second branch, as you can see, which one should we cover? Okay, let's go for this one. See, this one is going slightly towards the acromial process. So obviously the name given to it is the acromial branch. Is it okay? It's not visible. Over here it is. The acromial branch. Okay. So as its name suggests, again, the acromial branch, this is actually going towards the acromial process, and later on we will see that there when we talk about the scapular anastomosis and the scapular region blood supply, we will talk about an anastomosis that is located in the acromial region. So this acromial branch is actually a constituent of that anastomosis, but right now that's not really our point of discussion. So for all intents and purposes, that is the acromial branch. Next, there is another branch. This one is moving towards the clavicle. So this is the clavicular branch. The clavicular, is it? Yeah, okay, it's visible. The clavicular branch. Again, it's moving towards the clavicle, so that actually is self-explanatory. One extra information that you might actually remember about the clavicular branch, again up to you. If you don't want to complicate it, don't go for it. Clavicular branch is actually one of the branches which supplies the subclavius muscle. Okay, there is a muscle over here, subclavius, very important a muscle. We'll talk about it later in later discussions. This actually supplies the subclavius muscle and also the acromioclavicular joint. Okay, the acromioclavicular joint supplied by the clavicular branch. May or may not you really remember. These are really low yield information. I don't think these are pretty high yield information, pretty low yield information. The last branch of the thoracoacromial artery, which is itself a second branch, or rather second part branch, this branch. This is somewhat going towards a very extensive muscle which crosses, or rather is located over in this region. What muscle is located in this region? Very extensive. Yes, the deltoid. So this over here, this, my friends, is the deltoid branch. Is it visible? Yes, the deltoid branch. Okay, deltoid branch, this again has one high yield information regarding that. What is that? Deltoid branch runs in a groove when it see, it's going from the thoracoacromial artery, it's going like this. So when it is going like this towards the deltoid region, it is traversing a groove which is present in between the deltoid and the pectoralis. So pectoralis is somewhat, pectoralis major I mean, pectoralis major is somewhat like this, and the deltoid is somewhat like this over here. So in between the deltoid, which is like this, and the pectoralis major, which is like this, there is a groove present, which is known as the deltopectoral groove. Very important landmark. In dissection it is pretty well explained actually. And there are a number of structures which actually cross, or rather traverse, the deltopectoral groove. One of them is the deltoid branch of the thoracoacromial artery. Okay? Okay. So this completes all the sub branches of the thoracoacromial artery. Now, why did I say in the beginning that this is pretty easy to remember these four branches? If you take the first letters of all these four branches, this A, this is P or B, see, pectoral branch or breast branch, right? So if you take A, B, clavicular C, deltoid D. So such a good mnemonic you have over here. A, B, C, D. Acromial, breast branch or pectoral branch, clavicular branch, deltoid branch. So how simple it is, right? That's why it's easier to remember in this way. The last branch of the second part of the axillary artery, that is this one, going laterally and downwards like this. This is actually just like the thoracoacromial artery was emerging at the upper border of the pectoralis minor. This branch of the second part emerges at the lower border of the pectoralis major. This is known as, this second part branch, this is known as lateral thoracic artery. Lateral thoracic artery. It is going downwards, and obviously since it is lateral, this is the medial side and obviously this is the lateral side, so lateral thoracic artery. Okay, when we'll talk about the breast anatomy, we will come, and when we'll talk about the breast blood supply, then we will know the lateral thoracic artery is a very important artery in females, because when it is going down, it will give lateral mammary branches or lateral breast branches to the breast. So it is a very important as far as the breast blood supply is concerned. So that is one high yield information which will come in handy later. Okay. Now, third part of axillary artery. What exactly does the third part of axillary artery have to offer? Well, the third part of axillary artery is interesting again because it has three branches. as I've already mentioned. It has 3 branches. What are those 3 branches? Let's talk about them. First branch, let's talk about this branch, which is winding around the humerus anteriorly, like this. This branch over here, this is known as the anterior circumflex humeral artery. Anterior circumflex humeral artery. So see, if you remember, when we had talked about humerus anatomy, we had said that there is a bicipital groove over here in this region, right? In the bicipital groove, we had said that the tendon of biceps brachii along with the synovial sheath that actually crosses downwards. It's a passage for the biceps tendon. That's why bicipital groove. But we had also mentioned that there is an artery which traverses that. That artery is this artery, the ascending branch of the anterior circumflex humeral artery. Okay? Anterior circumflex humeral artery, that is giving up an ascending branch like this, and this will actually move on in the bicipital groove. Okay? Later on this will actually I have cut it short. This will move on, and then it will actually supply the head of the humerus along with the shoulder joint itself. Anyways, beyond our discussion, anterior circumflex humeral artery, by the way, itself it ends but or terminates by anastomosing with its counterpart from the posterior side, which brings us to the second branch of the third part of axillary artery, which is this thick branch that I have drawn over here. This is the posterior circumflex humeral artery. So posterior circumflex humeral artery. Okay, so posterior circumflex humeral artery, just like its anterior counterpart, winds around. That's why the name is circumflex. Circumflex means winding around. So posterior circumflex humeral artery will wind around, although posteriorly around the humerus, and again, as I had just mentioned, it will actually anastomose with the anterior circumflex humeral artery, forming what we say to be an anastomotic circle around the surgical neck of the humerus, which we also had talked about in the humerus anatomy. Okay? In the humerus anatomy, we had said that the surgical neck of the humerus, it's pretty important. Why? Because of the presence of this anastomotic circle along with the the axillary nerve also winds around it. So anyways, this is one of the reasons why the axillary, or rather why the surgical neck is important. This anastomotic circle between anterior and posterior circumflex humeral artery, that is actually present in the surgical neck, although it is depicted in this diagram. I have depicted it a little lower. It should be a little higher. I apologize for that. But anyways, this is how it is. Later on, when we will talk about the scapular region and the muscles of the scapular region, we will talk about a few intermuscular spaces. There are actually a few intermuscular spaces. Right now, I'm not going into the details of that. We'll talk about it later. But posterior circumflex humeral artery, that actually passes through the quadrangular intermuscular space. Okay. Do not worry if you do not understand, or if you are hearing this for the first time. Don't worry. You don't have to remember it right now. When we'll talk about the intermuscular spaces later in our later discussion, then it will be very, very easier to understand. By the way, I have not yet completed. See, the posterior circumflex humeral artery, it is giving this ascending branch over here, this ascending branch, and this descending branch over here, right? This ascending branch, again, we'll talk about it when we talk about the anastomotic region in the shoulder joint, or in the scapular region, or the scapular anastomosis. This descending branch, on the other hand, this also we will talk about later, because this will actually anastomose with the ascending branch of the profunda brachii artery. Again, when we talk about arm anatomy, when we talk about, there we will talk about this. So right now our scope is a little limited. That's what I'm trying to point out. Do not worry. That completes the anterior and posterior circumflex humeral artery. The last artery branch of the entire axillary artery, which is also a branch from the third part, it is this, going downwards. This is the largest branch of the axillary artery. This, my friends, this is the subscapular artery. Subscapular artery. This is the largest branch of the axillary artery. Very important information. Subscapular artery, again, better discussed in the scapular anastomosis region. But for now, all you can remember is it is the largest branch, and it is kind of, it actually runs around the lower border of the subscapularis muscle, right? And it terminates, if you can see, this is the scapula, and this is the inferior angle of the scapula. So it actually terminates in the inferior angle of the scapula itself, right? Not much to say over here. And supplies the latissimus dorsi and serratus anterior muscle. It gives a very important branch, which is, later we'll talk about it, the circumflex scapular branch, which I have actually drawn over here. This branch, this is the circumflex scapular branch. This is the circumflex scapular. Again, scope is limited, so we'll not talk about this. But in the scapular anastomosis, all of these will be a lot clearer. Okay. So that more or less actually completes the axillary artery branches, the axillary artery itself. Now, the rest of the section will be dedicated to the relations of the axillary artery, which are very important as well. So let's deal.